Jitendra Thakur.
Oh, they are yet to join.
So good evening, sir.
Should we wait for them?
We can wait for 2-3 minutes.
No problem. I can wait for them.
Because okay.
I can wait for them.
We can wait for 2-3 minutes just
Okay, no
because
problem.
they're saying.
हाँ बताइए ना. हाँ अभी पता चला ही नो मोर. ना वो मेरे व्हाट्सएप पर किसी आदमी ने फोटो के साथ हमको भेजा है थॉमस के साथ. 16 लाख रुपया पर डे खर्चा आ रहा था हैदराबाद.
हेलो.
मैं प्लान कर रहा था, अभी किया नहीं था, सोच रहा था.
2 मिनट.
हम फिर से दोबारा कंफर्म करके बताते हैं, कर लेते हैं.
It's a very sad news, sir. Yeah, Rohit. अच्छा. Good evening, Dr. Sumit. So, Dr. Gupta, shall I start because it's already 18:20?
No problem. I think your panelists are yet to join, or they have joined it.
Your voice is थोड़ा सा और audible नहीं है सर, थोड़ा
अच्छा
और.
ठीक, audible मैं करता हूँ. Panelists are available or they are yet to join?
No, panelist Dr. BK Singh is there. Dr. Sumit Kumar also joined.
Okay.
Jitendra has joined but logged out. Ajit has joined, logged out, and Jitendra to join, sir.
So we can start, no problem.
We can start, sir. By the time they will join.
Dr. BK Singh is in hurry. He has got some important.
Yeah. Sir, ठीक है,
I will start with him and then I will proceed to some other.
Yeah. Sir, just let me welcome you, Hannah. Just.
Okay.
So good evening, sir. On behalf of Alkem Laboratories, India's 5th largest pharmaceutical company, I, Ahmed Ali, welcome our eminent doctors who have joined us for today's panel discussion titled Views on Vildagliptin. At Alkem, it has always been our endeavor to partner with healthcare professions, and we will continue to do so even in these challenging times. To help us navigate the meeting, we have with today the eminent personality, Dr. A.K. Gupta, who will be our moderator for today's panel discussion. Take this opportunity to welcome the moderator of the day, Dr. A.K. Gupta. Dr. Ashok Kumar Gupta is a reputed cardiologist of Bihar, not only Darbhanga, Bihar. He has extensively experienced diagnosing and treating cardiac disorder and has been associated with the prestigious Darbhanga Medical College for a long time. He has been the life member of Cardiology Society of India, Association of Physicians of India, and India Medical Associations. Now I would like to introduce our panelist also. Dr. B.K. Singh, MD Medicine, is a renowned physician of Darbhanga. He is a well-known figure in Darbhanga. Dr. Sumit Kumar, MD Medicine, is a well-known physician of Darbhanga. And Dr. Ajit Kumar Singh, a young cardiologist of Madhubani, Assistant Professor, Madhubani Medical College, Madhubani, Consultant Interventional Cardiologist, Prashant Hospital, Muzaffarpur, and former Consultant and Interventional Cardiologist, Paras HMRI Hospital, Patna.
अरे आ ही नहीं रहा और साउंड बैकग्राउंड साउंड सुनाई पड़ रहा है और पिक्चर वगैरह ही नहीं रहा. हाँ हाँ हेलो हेलो.
Yes, sir.
हेलो.
My sound is not coming, sir.
कुछ सुनाई नहीं पड़ रहा, कुछ दिखाई नहीं पड़ रहा. हेलो.
Okay, sir. Okay, sir. And Dr. Sir, Dr. Ekagupta, it is visible or audible?
It is audible.
Audible. Your photo is visible.
I can hear your sound, your voice.
Yeah.
I can hear your voice. That's all. But I can't see any picture. Then.
But the picture is there, but.
Let me try again.
I will sort out this issue. And Dr. Jitendra Thakur, a well-known physician of Madhubani.
Let him talk.
Okay. Over to, then I would like to invite Dr. A.K. Gupta to set a contest for this webinar. So over to Dr. A.K. Gupta.
Thank you very much. And
Hello.
I'm very glad to welcome my all panelists.
Hello.
Dr. B.K. Singh, am I audible?
Okay, audible.
Then
You are audible.
Yes.
The picture is not seen.
No matter whether I see your picture or you see my picture. If I'm audible, it is
I
okay.
cannot see your.
My sound is, I think, audible.
Hello.
My voice is audible.
Yes, sir. Your sound is audible. Your sound is audible.
Yes.
Sound is audible, then we can do. No problem. Might be some technical fault. So I'm aware, Dr. B.K. Singh, that you are in a hurry. You have got some certain important engagement. And this evening, we are going to discuss about a very interesting molecule, vildagliptin, which has been in use for the last 10 years, but in recent 1 year, it has been resurgence in its use. Hardly there any pharmaceutical company which is not marketing this molecule, and this speaks a lot about its popularity. Now the photograph is also audible, and it has been claimed to be one of the best molecules so far oral hypoglycemic agent is concerned. Because you are in nephrology and dealing a large number of patients of renal diseases, may I ask you, what is your opinion about this molecule in renal patient, and how far you depend on this molecule, and how frequent you use this molecule in your renal patient, apart from routine type 2 diabetic patient? Over to Dr. B.K. Singh.
Okay. Thank you, Dr. A.K. Gupta sir. Actually, as a nephrologist, I am treating so many patients of diabetic nephropathy, and nephropathy may be in earlier stage, nephropathy may be in some advanced stage, or nephropathy may be in very advanced stage. So what is my experience about treatment of diabetes is, initially to start with, when lot of these molecules, gliptins, were not available, we had no option but to try only insulin in those patients, and many of the patients were hesitant of taking this insulin. As regard the other molecules are concerned, they were not very safe during the course of renal disease. If you prescribe some other drugs other than gliptins, then what happened? The patient might suffer from hypoglycemia, because in case of renal diseases, there is increased sensitivity of insulin, and the drugs which increases the excretion of insulin from the pancreas at the same time, due to increased sensitivity, patient used to suffer from hypoglycemia. So we know the previous drugs, when the very biological half-life, and once the patient went into hypoglycemia, it was very difficult to treat the hypoglycemia. Now, the physicians and the nephrologists were in search of such a good drug which can be used safely in renal failure, in the mild to moderate disease. So this Vidagliptin came as a boon for treatment of kidney patients. This drug, Vidagliptin, can be prescribed in mild to moderate degree of renal failure. Mild means when we say that the patient is having the mild nephropathy, then we are concerned with the GFR. When the GFR is reduced to almost say 60%, it is mild. And when GFR is reduced up to 30%, then it is moderate. So in these two groups especially, the patient can be treated by Vidagliptin. Now, the literatures are available when can you try this drug alone, or whether this drug can be combined with other drugs. So as regards the metformin concern, we are prescribing that nephropathy is not there. We can combine this drug with metformin, because in advanced degree of renal failure, if you combine this drug with metformin, the patient may suffer from lactic acidosis. So if there is no advanced renal failure, even the moderate renal failure, in that case, this drug is used safely alone. It can be combined with other drugs also, but with very precaution. These drugs should be given on BD doses. Once OD doses is not recommended, because the biological half-life is less. And by event of this Vidagliptin, the patients are very much benefited, and this can be prescribed in mild to moderate degree of renal failure. In very severe and very advanced cases, I won't recommend this drug to be given. So I think I'm clear. So have you got any queries regarding this treatment of this Vidagliptin in renal failure? Please let me know so that I can answer. Hello.
So, okay. Anything more information from Dr. Dickerson?
More info, when the dosage is concerned, we see the 50 milligram BD dosage is the dosage scheduled for treatment of diabetes. But when the patient goes into the moderate degree of renal failure, the dosage has to be adjusted according to the degree of the renal failure. So in most of the cases, the dosage of this Vidagliptin has to be reduced to half. So 50 milligram dosage may be reduced to 25 milligram BD, or only OD doses, 50 milligram OD. So that is the usual recommendation. And regarding the combination of drugs, I have already told you that it can be combined with the insulin. It can be combined with the other hypoglycemic agents safely, except the metformin. When renal failure is advanced, that should not be combined. Anything else you want to know from my side?
No, thank you, Dr. Dikar Singh, for your very detailed information of Vidagliptin in failure. So we also agree that in renal failure patient, we are scared of using sulfonylurea. One of the best molecule to be used in renal failure is insulin, no doubt. It is beyond any doubt. But if you are tempted to use any oral hypoglycemic agent, I think gliptins, or especially the vildagliptin, is a superior molecule, because the chances of hypoglycemia is virtually nil with this molecule. And you are very much true that it is a reasonable drug in mild to moderate cases. In advanced cases, we must depend on insulin. It is easy to titrate. So it is a good drug, and it is renal friendly. And in moderate to advanced cases, the dose has to be reduced as compared to the. So thank you very much for your valuable suggestion and comment.
Thank you.
So thank you very much. Now we shall move to the other issue, and I will now like to include Dr. Ajit, who happens to be assistant professor cardiology at Madhubani Medical College, and as he has got a large number of experience in cardiac patients. So, Dr. Ajit, may I ask you how often or how you prefer this molecule in your cardiac patient, particularly the patient who have got a lot of comorbidities like hypertension and diabetes and ischemic heart disease. Which molecule you prefer, and how this what is your choice about this molecule, vildagliptin, and especially in cardiovascular subjects? Dr. Ajit, if it is available. I think
So Dr. Ajit is not there. He has not joined. Yeah.
Can I know the name of other?
No, only Birinder Kumar has joined. But so
Dr.
they have joined, logged in and logged out.
Which one? Dr. Birinder?
Dr. Birinder is there.
Oh, Dr. Birinder. Now, the same question to Dr. Birinder. Now, I will like to modify the issue of discussion. Dr. Birinder, how often you need to prescribe an add-on molecule in a patient of type 2 diabetes mellitus who is already taking metformin? Your choice will be either sulfonylurea, vildagliptin, or pioglitazone, or SGLT2 inhibitors. What is your approach, and what is your choice, and what is your comment on this combination of vildagliptin in type 2 diabetes mellitus? Dr. Birinder. I think he is not also available.
He is not seen in the screen, sir.
Is there any person available?
No. At present, they don't have, only attendees there.
At the moment, I'm alone. Am I alone?
Yes, sir, you are alone.
So I will like to have some comment on this molecule. Should I proceed further, or
no? Because I think because of this incidents, doctor is not joining. हमको लगता है कि so
should we stop here, or should we?
No, because other panelists is not there, since many of the doctors are attending. About 50-60 doctors are seeing this program. So you give your expert comments and we'll end up this here.
तो क्या किया जाए, अभी स्टॉप करें या अभी वेट करना है, या हम कुछ कमेंट करें इस पर?
Comment कर दीजिए सर, comment कर, because attendee other doctors are listening here.
Oh, no problem. Now, so far this molecule vildagliptin is concerned, I would like to, most of you know that this molecule was born around 10 to 12 years back, and it it was recognized in UK, and the first trial was started from UK as a trial. Incidentally, I was also the participant of that trial, and it had a very favorable, it was found to be a very favorable drug as an add-on therapy. Now, the attractive feature of this vildagliptin is that beta cell failure, it is one drug which is known for preservation of beta cell. The sulfonylurea or secretagogue, which we are using since very long time, are known to stimulate beta cell to secrete more and more insulin. And thereby, on account of exhaustion, it may lead to early beta cell failure. No such beta cell failure is seen after the use of vildagliptin. If it occurs very slowly as compared to sulfonylurea. So my approach is when I found a new onset patient, particularly type 2 diabetes, I often motivate them to start with insulin. But those patients who are hesitant to insulin, I often ask them to start with this vildagliptin and metformin combination, depending upon their glycemic level. And I have found that they get a very excellent control of blood sugar. And the second attractive feature is the incidence of hypoglycemia is negligible. There is no problem of weight gain as seen with the other molecule. And the quality of life is also very much maintained. Then I have also used in elderly patient. Elderly patient are they tolerate this molecule very nicely. So far, the untoward effects of oral hypoglycemic agent like peripheral edema, gastrointestinal disturbances, or hypoglycemia or weight gain is not usually seen with vildagliptin. So it is a safe molecule so far elderly population is concerned, and virtually it has got no side effect. So far renal patient is concerned, Dr. B.K. Singh has nicely explained. It is a very good molecule in renal patient. There is no fear of hypoglycemia, and we can titrate the dose easily. The patient may require insulin if he does fail to control with oral hypoglycemic agent like vildagliptin. So far cardiac patient is concerned, those patients who are ischemic heart patient, SGLT1 inhibitor has scored number 1 position on account of its favorable response and favorable response on atheroma also. And if SGL2 is combined with vildagliptin, the effect are excellent, robust, and we get a very good control of glycosylated hemoglobin, and the endogenous glucose production, which is raised in cases of SGL2 inhibitor, is reduced when we combine with DPP4 inhibitor. So it is a very good companion drug if we use the SGL2 inhibitor. So seeing its beta cell preservation capacity and no hypoglycemia, no weight gain, renal friendly, elderly friendly, and very good partner in cardiac patient along with SGLT2, I think it should be highly recommended and accepted by our all classes of type 2 diabetes mellitus patient. I think this is enough comment for this molecule. If any query, I will welcome to answer their query.
At present, we do not have any queries from the chat box, sir.
Okay.
So,
I think I have covered in a short period almost important aspect of vildagliptin. And
correct, sir. You have covered all the important aspects there. Yeah.
So, should we conclude?
Yes, sir. Beside this, we have one short. Yes, sir. We have recently glad to inform you that we have launched the Vilda OD, sir,
Non-Vilda OD.
which is GODI. This is a first in the world from Alkem. Global OD. Once daily, the cost is very affordable, very rupees per tablet, sir.
Okay.
And if you see the mean DPP-4 inhibitor, 85.2% with vildagliptin SR versus 86.8% with innovator brand, 50 mg BID. So patient compliance is there, and bioequivalent to the innovator brand, 50 mg BID, sir.
Okay.
And 84% DPP-4 inhibitor over. Yeah, pardon, sir.
It is a welcome addition in the basket.
Yeah.
This
Yes, sir.
Very good molecule.
Yeah.
Thank you very much.
84% DPP-4 inhibitor over 4 hours with vildagliptin, yes, sir, at par with the innovator brand 50 mg. Beside this, one thing I would like to discuss in this pandemic situation, sir, connect to clinic. Because in this pandemic situation, it's very difficult to see the patient physically, sir. So now we have a connect to clinic, can prepare a virtual clinic at your home also, sir. It is a very safe and secure, sir. HEPA security is there. So many science I would like to see here. That is
okay. Thank
instant
you.
custody. Yes, sir. Unique feature of Connect to Clinic is there, sir. Credential-based login by the doctors. Patient bulk upload. Doctors can upload the patient data. He can view the details of the patient. Prescription can be shared by email or SMS. Provision of adding the alternate number by the doctors also is there, sir. So it is a very important feature, instant consultation, sir. Doctor can initiate instant consultation, sir, with patient without the need of booking the time slot, sir. And one very important feature added, sir, the 3 ways every consultation. Patient caregiver, the consultation to the patient, and now caregiver and patient join the consultation with the doctors. Very important. There is medical update, which is very academic, sir. The medical update is there, sir. There are various updates there, sir. About 60 to 65 different journals are there. So you can share with the patient, share with you. We can share there, sir. All international journals, articles, and no extra cost of there, sir. Patient education module is also there, sir. Enhances user journey for both doctors and patient by allowing doctors to share the collateral with the patients and patient education. And role creation option for staff can make edits and booking other than prescription and fee also, sir. So your patient can. So this is a unique feature, sir. Sorry.
Okay. आवाज नहीं आ रही तो है आवाज नहीं आ रही
So shall I conclude the session, sir?
Hello.
So is it audible, sir?
Okay.
Rehan,
Yes, sir.
is
Okay.
it audible?
Thank you very much.
So,
Thank you very much.
Sir, we take this opportunity to thank Dr. A.K. Gupta for moderating the panel discussion and all the panelists sharing the views on vildagliptin in clinical practice. We would also thank all the doctors who have joined us for the panel discussion, and I'm sure you will appreciate the views on vildagliptin present today. And we at Alkem Laboratories will continue to serve doctors and patients by making our products available, especially our chronic brands like Gluvilda M, Jupiros, and Allchem. Thank you, sir. Thank you for your valuable time given for this.
Thank you very much.
And giving your. Thank you, sir.
Thank
Thank you, Dr. K. Gupta. Thanks. Thanks. Good night, sir.